And you'll have free to screenshot any of my slides and keep them as well, based on how you feel. Okay, so quick introduction. Already Dr. Paul has gone ahead. Are my slides moving, or am I still stuck on the first slide?
Still on the first
You're
slide.
stuck.
Okay. Are we moving now?
Yes.
Okay. So today's talk is on drowning and submersion related injuries. So quick brief introduction. I was in the Indian Navy for about 25 years. I'm also a scuba diving instructor, one of the few technical and research divers and instructors in the country. I also work as a critical care paramedic for a Canadian ambulance service. I'm a diver medical technician. I do a lot of exploration, teach wilderness medicine, as well as austere and remote medicine for quite a few places. I'm also a faculty, as Dr. Paul said, at the College of Remote and Offshore Medicine, as well as Manipal as adjunct faculty. So our objectives today are to understand our drowning, get the definitions going. Basic epidemiology, I'll cover about certain risk groups and how drowning affects us. I'll briefly cover physiology, not too much, just to understand what we talk about certain terms. I'll cover the 6 stages of drowning, what to do as if you're a layperson bystander, pre-hospital emergency treatment by EMS. Again, it'll be a small slide, not too much. And then I'll just show you the Wilderness Medical Society clinical practice guidelines as a reference, and then hand over to Dr. Paul for further management. So to understand drowning, right? So drowning is defined as the process of experiencing respiratory impairment by submersion or immersion in the liquid. Now, when you say in liquid, primarily you want to think about any liquid, and the airway being compromised would be considered as drowning. And a submersion and immersion have two separate meanings in certain places where you could be immersed with your airway open. So in drowning, your airway has to be below the surface of the liquid. So primarily, it's a continuum that begins when the victim's face or airway is below the surface of the liquid. Okay, so hypoxemia is low oxygen in the blood, which is caused because of drowning. When you have submersion of the airway or immersion of the airway, there is no transfer of gas, and therefore you have low oxygen developed, which is basically the whole pathophysiology of drowning causing cardiac arrest or any impairment. So morbidity, again, understanding morbidity primarily because we have drowning as fatal, non-fatal, and whether there's morbidity involved. There's no such thing as near drowning anymore. We do not use the term. Mortality is the act of death or the rate of death. So depending upon how we look at these things, you'll find various definitions in textbooks, talking especially about patients who have had near drowning experience, or as we call it, no mortality or morbidity continues to remain a system where they had an event and they need further care. And Dr. Nikhil will cover the further care in the hospital and beyond. Risk groups, we primarily know that drowning has reduced last year. About still we have a less than 1,000 deaths per day, so around 8,878 deaths per day. And these are the last 2023 reports, 2024 reports which have come in. The highest mortality or is between the ages of 0 to 4, so infants and children aged up to 4 across the globe. And this is not just in developed countries, but in all environments where there are human beings. The highest level of mortality is between 0 to 4 years. The next we know is that males are twice as much prone to drowning related injuries. And this is because of multiple reasons, whether there is a greater exposure of males to water bodies, whether it is society based, whether it is based upon them being high, testosterone being linked to higher riskier behavior, alcohol use, and again, exposure to all these events. So we do know that males are twice as likely to drown. Now, again, children globally 0 to 4 years. So be careful of your kids, even in bathtubs, even in bathrooms, small buckets, anywhere where there is a 2 inch water level. Now, the next group, which is risky again, is children plus young adults. So 57% of the total fatalities have been between age 0 to 29. Obviously, the age group 0 to 4 is great. So this again shows you that younger people are more inclined to having fatalities in near water bodies, which does not mean that you don't go near water bodies. You just have to be careful when you're around them and make sure you take adequate care about flotation devices and such. So we covered males again, primarily because of increased risk of exposure, alcohol, and risky behavior. Now, we also have data which corresponds to this disproportionate risk due to poverty, as in people in lower and middle income societies and communities have a much higher rate and risk of drowning and a higher rate of mortality. And primarily that could be linked towards drinking water collection from open water bodies, washing in open ponds, tending to cattle, water troughs for cattle, and so on and so forth, which you don't really see happening too much in developed nations. Approximately 32,000 fishers die per year, and this is all due to drowning related deaths. Uh, and again, primarily because if you're looking at people whose occupation takes them on the boat, takes them onto a water body. So you have a large number of fishers. This is again a global number. You have a large number of people who operate on the ocean, boat captains. You have water transport. In certain low and middle income countries, again, you have inadequate legislation, inadequate regulation, poor upkeep of material, and poor overcrowding on boats, primarily because people just need to get from place A to place B, and there's no other option. We've had a few cases covered in the media, and again, as I said, earlier, and it's on the slide, inadequate legislation and regulation is one of the key reasons for water transport related deaths. We had Abdullah talk about climate disaster and global changes in weather patterns, which have increased flooding and therefore increased the risk of drowning for our uh, fellow human beings. Now, one thing which really doesn't come up in some cases is the fact that a lot of migration and conflict, including happens over locations which are very unforgiving. A lot of cross-border migration happens over oceans, over unforgiving seas, over some water bodies which have historically been known to be very rough. Also, a lot of times these happen at night under the cover of darkness, and you have river crossings. You have it in times when there are floods, primarily because you're also looking at if it's harder to get across, it's also harder to monitor. It's harder for the border patrol to be available. So therefore, there's a greater increase in such movement across water bodies, which obviously increases the risk of drowning and drowning related deaths. So now moving to physiology, we've been talking about airway a little bit, and so this is primarily like an upper airway where you can see you have the nose, you have, and if you follow the blue marking, you'll follow the air moving in, and therefore the airway. And primarily, this is the way to get air in through your nose and through your mouth as well. So you have the nasopharynx and the oropharynx, and then you have the laryngopharynx going down. Now, any compromise in this, as you can see, is connected to your lungs, which are your primary, and your alveoli, which are your primary gas exchange location for the body. Now, in a normal situation, if you close the mouth and nose, there is no gas exchange happening because it's just stagnant in the lungs. Now, as we normally breathe, we keep moving gas around. So in case there is a closure of the airway by water, or there is ingress or water is intaken by the airway when you're in the water, you will have poor exchange because the lungs are not supposed to be filled with water. They're supposed to be they have a certain fluid called a surfactant, uh, which is basically a surfactant, like a soapy material that allows easy gas exchange and keeps the alveoli open. So any compromise on the airway is going to cause poor oxygenation and therefore will lead into hypoxemia. So we need to protect the airway to prevent drowning. Okay, this is a slightly more elaborate image of the physiology that causes drowning, and I'll cover this as we go further. I'm just leaving this for a few seconds for you all to take a look. So now we'll move on to the 6 stages of drowning, and then we'll cover part of the physiology as we go ahead. So the first stage starts when you have an inability to keep the airway clear, which primarily means, let's say you're in the water, you've either had an event which has made you unconscious and you're face down in the water, you're unable to keep your airway clear. Now, in case you are conscious and you are swimming and you're in the pool or in water body, you eventually will get tired if you're not holding onto something. That will impair your ability to keep your airway clear. So that again is a second way of your airway not being kept clear. Now then, the initial submersion, which is from a wave or when you go down because you're exhausted, that leads to a sudden laryngospasm, which causes breath holding. That breath holding then opens up, and then you suddenly have an urge to breathe. There is no air available, so you breathe water, which is basically aspiration of water. Now, from stage 3 to stage 4, the time to unconsciousness depends upon multiple factors. Uh, some of the factors include age, size of the person, their physical ability, how long they have been in the water already, whether the water temperature is warm, cold, uh, and all that kind of situation. There's also something to remember that adults have a greater oxygen and glucose capacity than children and older adults like geriatrics. So you need to think about the fact that if a child has fallen into the water or a child has been swimming long and they now cannot hold themselves above the airway clear above the water, their time to unconsciousness after submersion and breath holding is going to be very rapid. So this leads again to time to cardio and respiratory arrest, which basically is a following from the time to unconsciousness. Unconsciousness doesn't necessarily mean cardiorespiratory arrest. So generally, if you get somebody out of the water from any of these stages, there is a chance to revive the patient. However, we also know that water temperature plays a huge role in resuscitation and recovery for a patient, primarily because colder water tends to act like a freezer and kind of does. Um, and obviously, Dr. Nikhil will be able to elaborate more on this. It acts more like a suspended animation. So it does not allow, so metabolic processes slow down and therefore the time to cardiorespiratory arrest increases. And therefore also time to resuscitation is better. And the final stage is death. So if you have the ability to recover somebody from stage 5 to 1 to 5, do it as soon as possible and avoid stage 6. So the 6 stages of drowning, again, this is just an image, and it maybe makes it easier for you to see how and the progress happens. And some of my slides which have images have references available, and they have been taken. Please take, if you need screenshots, please take them. So bystander first aid, we'll first look at the chain of survival for drowning. Everything has a chain of survival, and we have these lovely diagrams available for cardiac arrest, for stroke, for all kinds of medical infographics, which are great as long as you follow them. So remember, the first step is to prevent. So prevention is always better than cure. So prevent drowning, be in a safe area, be safe near water. As you can see in the image, the person is wearing a life flotation vest, and also understand that if you're not a swimmer or you're not comfortable with water and you're in a water which is basically greater than 2 inches, and you get exhausted, please be sure to get out. So a lot of people forget that they can slip and hurt themselves and fall even while they're in a shallow pool or having fun by a waterfall or any other such water body. Recognize the distress, ask someone to call for help, provide flotation, and we'll go ahead as we talk about this. So remember, first, as a rescuer, as a bystander, your first job is to keep yourself safe and call for help. Making sure that you do not get into the water is the best option. There has been a documented number of 114 deaths in 1 year in Turkey, and 114 deaths of rescuers when they tried to get into the water and rescue somebody who was drowning. So be careful. So when we say get out, get the victim out of the water, we want to follow at least these 4 steps. The first is reach. So reaching basically means that you reach the person with a life jacket, a flotation device, a stick or a paddle or a rope or anything that they can grab onto and then pull them out. Now, this is obviously good to do when the patient is still in, or the victim is still in around the first 3 stages of drowning rather than stage 5. So the reach method, follow that you throw, which is basically again throwing a life buoy, a flotation device. Could be a jacket, could be a mattress, could be anything that floats, a piece of wood that the victim could grab onto and then maybe swim themselves up, or then you could maybe throw a rope and have them come across. If you have the ability and if you have a boat or a raft, that's the next step of rowing and going across, paddling, and grabbing them. Now, only go into the water if you are a trained lifeguard, stroke rescue swimmer, dive instructor who has in water training, who has the capability, not just if you're trained, also physically able to do it. If you did it 20 years ago and you now haven't done it in the last 6 months, I would say don't go, because you will put yourself into danger as well. And you do not want to increase the number of victims. Now, once you get the victim out of the water, you want to check for a breathing, check for a pulse, sorry, and check for breathing. Now, you do not want to spend too much time and dwell on this for a very more than 10 seconds. So the idea here being is that you can place a hand on their chest and see if there's any movement happening. At the same time, you place your fingers on their carotid pulse and see how whether you get any movement at all. Looking across the chest, keeping your ear next to their face is also good. You can hear and feel any breathing that's happening. In case there is no breathing and there is no pulse, the first thing to do is to give 5 rescue breaths and start CPR. Now, CPR is cardiopulmonary resuscitation, and that basically is compressing the chest, placing your hands in the center of the chest and giving 100 to 120 compressions per minute. Ideally, about 2.5 inches for adults and about uh, half the size of the patient's chest if they are a younger adult or a child. Do 2 breaths every 30 compressions and do not interrupt compressions longer than 10 seconds. We are not trying to teach y'all CPR online or here, and it's generally not possible to do that. We'd rather have you attend a full class and do it properly rather than uh, just say that I've learned CPR on this lecture. But at the same time, I would say if you have an understanding of what I'm trying to say, please don't stop and definitely give the rescue breaths and start CPR. Now, what you'll have to do is you'll have to continue till emergency services arrive, because the minute you stop compressions on a person who doesn't have a pulse, they are no longer going to have any life left. So you're the one who's basically doing the job for their heart, and you will need to continue till emergency services arrive. This doesn't mean that you keep doing it yourself. You need to keep the victim warm, and you need to use help from any bystanders as required. So if you've got more people around, friends, if you've already called for help, people should start coming in and thereafter use as much help as you can. Now, bear in mind that in certain places like pools, certain other recreational organizations, certain gyms and places like that, which have a well-structured environment, you might have people who are already trained in CPR. There might be devices known as automatic emergency defibrillators and such, and they will be trained in that. So please definitely call for help and ask for assistance. So in case of vehicular entrapment now, there's something which, as a bystander, you can advise people, as well as in case you or any family or friends do get stuck in a vehicle that gets stuck in, like we were talking about climate related issues of flooding or any damage that happens to any bridge or such kind of situation. There's something called SWOC. So seat belts off, windows open, out immediately, and children first. So you want to think about opening the seat belts, getting ready to get out of the car immediately. So as soon as the submersion of the vehicle starts, you open the seat belts, open the windows, and you start getting out. And when you say out immediately, you'll have to remember that as soon as this vehicle starts getting submerged, it's going to be difficult to open the windows or open the doors, primarily because there's going to be hydrostatic pressure from outside coming onto the windows and doors. Children first. Always remember women and children first. That's the old adage of lifeguards and boats. So I'm moving on quickly to pre-hospital EMS treatment, and this is generally where I'm almost going to end my talk in a few minutes. I hope I haven't overshot time. So again, pre-hospital EMS treatment would be CPR after the victim has been brought out, positive pressure ventilation with 15 liters of per minute oxygen, transport to higher care immediately if patient regains a pulse. You don't want to play around with the patient, even though you might be high quality EMS or highly trained EMS, sorry. Advanced cardiac life support as per protocol and as per training. If your protocol says stay in place till the time the patient gets a pulse back, you might have to continue cardiac life support as protocol. Now, keeping the victim warm is important here as well, because bear in mind that they have limited resources of oxygen, which means their body is now trying to work whatever they have, whatever resources they have to keep them alive, and therefore they have kind of diminished their stores of glucose or any other brown fat that they may have in keeping themselves warm. And this is the Wilderness Medical Society clinical practice guidelines for treatment and prevention of drowning, updated in 2024. Again, you can take a screenshot. The Wilderness Medical Society is a non-profit organization. I am presently a fellow of the Academy of Wilderness Medicine, and it's the clinical practice guidelines cover a lot of subjects, including frostbite, high altitude medical sickness, toxicology, snake bite, a lot of outdoor medicine related clinical practice guidelines. So please go ahead, look at them. It's free for anybody, the clinical practice guidelines. However, membership is at a certain fee. There's a reduced rate for students and for medical practitioners or anybody in a low and middle income community. And I have finished. Over to you, Dr. Paul.
Yes, thank you, Commander, for giving in detail about the pre-hospital management as well as the first aid aspects of drowning. Now, just bear with me as I share my PPT. All right, I hope it's moving. I hope the slides are moving, or am I stuck?
Yep, moving around.
Right. Thank you. I'll take it from where he started. So I'm Dr. Nikhil Paul. I'm an assistant professor, emergency medicine at Kasturba Medical College, Mangalore. I'm also the regional coordinator of Avoidable Deaths Network. I also do a little bit of outdoor medical training through my organization, that is Outdoor Medics. So I'll be covering a little bit of complications of drowning, emergency department treatment, and few aspects of prevention of drowning. Uh, just one thing, there are around 333 lakhs annual drowning deaths worldwide, according to WHO. So it's a leading cause of child death in countries of all income levels, both low and middle income countries, more of which accounts for 90% of child drowning globally also. A lot of facts about drowning. Drowning is a big problem, especially in some countries in Asia, like Bangladesh. Then we have in India also some places like Odisha where drowning is a big issue. Let's look at some complications. This has been a little bit covered under the physiology aspects by Commander. And now I'll just go into each complications. In drowning, sometimes we have something called the laryngospasm. That is the spasm of the larynx or the voice box, that area. So, but it's happens only very rarely. That means maybe around 10%. So in this case, what happens? The larynx or your upper airway just closes off. No water goes inside, but the person is not able to breathe, and they die. I mean, they stop breathing, they go into cardiac arrest. This may be sometimes referred to as a dry drowning, wherein water is not inside. Now, 90% of the case, we have aspiration of the water inside the lung. Uh, then you have the surfactant failure uh, as it was mentioned earlier. So surfactant is the soapy substance which is present inside the lungs, which helps in gas exchange, which causes for the collapse of the alveoli. What happens later is something called an increased fluid inside the lung, which is referred to as a pulmonary edema. But actually, that is more like a reaction of the lung, which is called an ARDS or adult respiratory distress syndrome. Bear with me, we have a little bit of medical things in this presentation. Some of the medical uh, people from medical background have also joined in this. So next complication can be a cerebral hypoxia or reduced oxygenation inside the brain. So it depends upon the submersion time or the downtime. So the amount of time you are underwater, or also the temperature of the water. So in fact, a low temperature or hypothermia has a protective effect on the brain. In fact, that reduces the damage. In fact, like so, the reduces the requirement for oxygen inside the brain. That's all right. So then we have various electrolyte derangements. That is derangements in your body electrolytes like sodium, potassium, and also, as per theory, it is more profound in seawater or saltwater drowning because seawater has is more hyperosmolar, which attracts all the water out of the circulation, which causes the body hypovolemia, and there is concentration of the electrolytes in our blood. Now, hypothermia is a problem. Hypothermia itself can cause cardiac arrest, but hypothermia can have a protective effect on the in case of drowning by reducing the oxygen demand and has a better neurological outcome. There has been cases reported of I have read a case report of a child who was drowned for more than 83 minutes, who was rescued out, and the initial temperature was somewhere around uh, 18 degrees Celsius, which who was later rescued, resuscitated, and the child was in profound hypothermia, rescued, resuscitated, and started on ECMO and recovered. Renal effects of drowning. So, in fact, this are limited because before the renal effects start, in most of the time, the death occurs, but can occur in case of massive freshwater. I mean, in case of freshwater drowning, where too much of volume of freshwater goes inside, can cause hemoglobinuria and tubular damage as well. In freshwater drowning, another problem is due to hemodilution because of a large volume inside. Hemolysis also happen. Um, Another important thing is a secondary infection due to aspiration of the contaminated material in the water or the fluid where they are drowning. So these are some of the complications. just wanted to put in the predictors of poor outcome, poor neurological outcome following drowning. This is in case if we have rescued someone out of water and you are trying to resuscitate them. So some of them include immersion for more than 5 minutes, a delay in CPR longer than 10 minutes, GCS of 3, Glasgow Coma scale of 3, and fixed dilated pupil on admission. That just means the patient is completely unconscious and pupils are dilated when the acid base levels are checked, severe acidosis as well, or an abnormal neurology during admission. So a little bit detail about cardiac arrest following drowning. Usually we have a cardiac arrest which is non-shockable in case of drowning. Usually the rhythms what we come across will be a sinus tachy or a bradycardia or a pulseless electrical activity. So we may not get the ventricular fibrillation or ventricular tachycardia. So if there is a shockable rhythm in a cardiac arrest following drowning, there might be some secondary causes which has caused the drowning as well. So you need to look into that as well. A brief approach to drowning in the emergency. So it depends upon whether their Glasgow coma scale is more than 13 or the oxygen saturation is more than 95. If GCS is more than 13 or saturation is more than 95, you can keep uh, monitor the oxygen saturation, do some tests which is required. Uh, Cervical spine has to be stabilized if required, and observe them for 4 to 6 hours. If they are still maintaining everything and they can still be discharged if they are maintaining all these parameters. Now, if it is less than 13 and saturation is less than 95, then we'll have to start on various mechanisms, include better oxygenation. Depending upon the device what we use, we may have to go for endotracheal intubation, that is putting a tube through the mouth and stabilizing the airway and the breathing as well. We have to consider further tests and monitor in an ICU setting. That would be the basic approach. Now, the treatment aims is to reverse the hypoxia, which is caused because of drowning. So we can go in for a ventilation strategy wherein you have to increase the FiO2 as well as provide positive pressure. So most often, if the patient is conscious enough, you can go for a non-invasive ventilation strategy. If the patient is unconscious, we will have to go for an invasive ventilatory strategy wherein we have to titrate the PEEP. You have to give positive pressure accordingly so that you open all the alveoli. Now, clearing the airway is another thing which is a priority in the emergency. As a result of drowning, there will be a lot of vomiting as well. So, suctioning the vomiters is important. There might be foam which is coming out. That is because of the surfactant which is coming out. Uh, so, foam, you don't need to suction out everything, but you can still continue the ventilation and push back into the lung. So, obtaining other things like a chest X-ray, an RTG blood gas analysis, and a blood glucose is also important in the emergency. Now, if there is a secondary drowning, for example, now as I told, if there is a shockable rhythm in a drowning, it might be because of the person who was swimming, who had a cardiac arrest, I mean, a heart attack or a myocardial infarction causing a heart attack, and that might have caused the drowning. So look for secondary etiology. Now, monitor the hemodynamic instability. The hemodynamic parameters has to be stabilized. As I told, for the ventilation strategy, you can go for a protective ventilatory strategy where you go for titrating the positive and expiratory pressure uh, up so that you open the alveoli. If you have ECMO available in your setup, and if required, ECMO will be helpful. Hypothermia. So the thing is, the hypothermia, as I told, has a protective effect, and at the same time, when you resuscitate a person in hypothermia, you have a lot of considerations to be done in the advanced cardiac life support guidelines says you have to space out the epinephrine doses when you have a person in hypothermia, as well as you cannot declare a person as dead when unless you haven't rewarmed them to 37 degrees Celsius. So you declare only when they are rewarmed. Another thing is a possible aspiration of contaminated foreign material, vomiters, and chemical irritants, antibiotics, or other strategies has to be done. Electrolyte abnormalities has to be uh, dealt with according to the investigation findings. If uh, the person goes into disseminated intravascular coagulation or end organ damage, you may have to go for advanced critical care management accordingly. Not going too deep into that. Again, the in nutshell, the strategy is prioritize rescue breaths, avoid compression only CPR. So this is both in pre-hospital as well as in hospital. In case of drowning, compression only CPR may not really help, and you have to prioritize rescue breaths. Suction has to be done only if there is profuse vomiting. The foam coming out, you don't have to suction out everything. You can just bag everything back into the lungs. Prepare to treat for this pulmonary edema or the fluid overload, and you have to ventilate using lung protective strategies. It's a hypoxic event. Management is by FiO to increase and PEEP increase. So if there is persistent hypoxia, you can consider ECMO. And if there is a shockable rhythm, consider some other etiology into drowning. So this is again was discussed before I have finished my in-hospital consideration. The last topic which I have for today is about prevention of drowning. So I'll just discuss the first part of it, the prevention of drowning. So drowning has been a big problem, especially in childhood population. So WHO observes July 25 as the World Drowning Prevention Day also. So there are few guidelines which were put out from them, few strategies to reduce drowning, learning to swim, supervise children, no alcohol near water, be aware of surroundings, that is where water, you have to be really careful about getting into water. Unless you don't know about the water, you shouldn't get down. There might be undercurrent, you might slip and fall and all those things, and use safety equipment, which includes buoys and jackets. Now, again, these are some of the strategies again which was earlier present to power swimming, the learning swimming, barriers for swimming pools, um, life jackets, vigilant lifeguards, all those things. Now, prevention of drowning. These are the guidelines set by WHO. Provide safe place away from water for preschool children. Install barriers, like controlling the access to water. This include swimming pool barriers, closing the wells with some covering. Also, for all water bodies, you have to put in barriers. Teaching school age children swimming and water safety skills, that is very important. Nowadays, a lot of strategies has been put forward by WHO itself to train swimming. Building resilience and manage flood risk and other hazards, as Soma said in the beginning. So there is a lot of disaster thing which is happening. So, which I remember earlier this year, we had the rains which created havoc, which created floods. There was few vehicles which were uh, pushed into the water, deep waters, and caused drowning deaths. So building resilience and managing flood risk forms a good part, an important part of prevention of further drowning. Now, training bystanders in safe rescue and resuscitation, which includes training bystanders, CPR, first aid, and other aspects of immediate treatment of drowning, which includes training the lifeguards, training adventure professionals, and all those who are involved in some water related activity or who has access to water. So now set and enforce safe boating, shipping, and ferry regulations. These are very important. So every now and then we hear stories about uh, boats sinking. Like we have some of the worst boat accidents which has happened in the country last year. So enforce safe boating, shipping, and ferry regulations, which include mandatory life jacket and sticking to the number of people who can be carried onto the ferry or a boat. We don't want to happen something like this, which this is the Mumbai ferry accident which happened earlier this year. So we don't have to have want this to happen again. So those were some of the points which I had to share about prevention of drowning. This requires a lot of administrative as well as educational reforms to set up a good community who is resilient to drowning as well. So, sir, my references and thank you. Over to questions. So we both will be accepting questions. You can either unmute and ask, or you can put in the chat box as well.
I think with the limited audience, I think anybody who wants to ask a question, just unmute yourself and pipe up, please.
Yeah.
Hello, sir.
Yeah, please.
Sir, whether the CPR will help us to drain out the water from the alveoli, or it will just help for the cardiovascular resuscitation?
Right. So your question, what I understand is you are asking whether the CPR will help to remove the water from the alveoli. Right. Is that right?
Yes, sir. Yes.
So our primary aim in providing CPR or cardiopulmonary resuscitation, which includes the rescue breaths, not the compression only CPR, is to provide breath to get over the hypoxia and as well as get the heart beating. So apart from that, so the thing is, as per autopsy report, uh, the water inside the lung, it's not like the water just fills up the lung. So water in the lungs can be as per the reports which I read, like can be as little as 20 ml. So it doesn't mean that the water just fills up the lungs like a balloon. Water might go inside. That is true when the hypoxia sets in. Initially, what happens, there is a laryngospasm usually, but as the hypoxia sets in, the water goes inside, but there is limited water which goes inside for some reason. So our strategy is to uh, give breaths so that you get over the hypoxia and try to open up the alveoli with the help of positive pressure. So positive pressure stays the mainstay, like rescue breaths to tide over the situation, and immediately you have to move to positive pressure ventilation.
Okay, sir. Thank you.
Any other questions?
We are good with time. In any case, anybody
Yeah.
wants any questions answered on anything else that we do in terms of diving or outdoor medicine or paramedicine or medicine in general, which is non-consultive. Uh, please feel free to ask if you have any questions. Also, in case anybody has any questions that they would like answered separately, we can probably share our emails if required, and then you can ask us questions later.
You can mail us. We have a question. Any guide about drowning for common people in simple language we can understand, but a layperson may not understand medical terms. Um, do you have something of that sort, like Samantha? Can you suggest something?
Uh, Nishita, I would say if you have access to your local Red Cross, uh, primarily because the easiest way is to go to your local Red Cross or local Indian Life Saving Association group where they have it in the vernacular language. So your local language, whatever is being spoken there, would be best. They would be able. They would also have certain infographics available in the local language because India is massively, linguistically diverse. So we have languages and we have dialects and we have scripts. So it would be difficult for us to give you a language that we particularly speak, which is locally, and that way, without medical terms, the simplest thing would be like I said, bring somebody out. The way to get somebody out of the water is important. The way to start first rescue breaths, make sure that the airway is open and then go ahead. Because any other way of doing it would only increase the risk of the other person or the rescuer also getting into a drowning situation. So we would like to avoid that, prevention being the first thing. And any infographics, any other information that you would like, or local classes that need to be done in the local language, the local Red Cross and the local, like I said, Indian Life Saving Association are really good resources to just go and talk to them. They will definitely have something available in that sense.
Right. I think yeah, I think we have crossed the time. So, any final words from you, sir?
Stay safe and
Yeah,
learn to swim, learn to, be comfortable on the water. It's important. We have such a large coastline, and
yeah,
we have very few swimmers, let alone divers. So please definitely learn to swim and dive and enjoy the water. And enjoy the water. Enjoy the water as much as you can, safely.
yeah,
And
yeah.
thank
That
you,
that
Dr.
that.
Nikhil.
Yeah.
Sorry, thank you,
Thank you,
Dr.
Commander
Nikhil.
Vishnu. Yeah, thank you for joining, and thank you all for joining for this webinar. So hope we have come up with something useful. We have put both email address in the group chat. Please feel free to connect with us for any questions or queries. Also, you can find us in Instagram as well, the Outdoor Medics and Scuba Evolution India. So we have other programs which we conduct. Feel free to contact with us. Thank you all once again. Thank you for joining. Have a good day or good night wherever you are. All right. Thank you.
Thank you. Thank you, Nikhil. Thank you,
Yeah.
Commander.
Thank you.